Which medical condition is ridiculously demonized? Any kind of incontinence. Especially if you aren't a senior citizen. Fucking this. My brother, not real brother, just big homie, had colon cancer at a young age. Missed most of school and now has about 6 inches of colon. Has to wear diapers daily. He hid it from me for a long time. He had a blowout at my place because he refused to admit to me he had that condition. Now I keep 4 recharged packs with cleaning kit. We got a dude to make a dope leather bag. We just call it the kit. If he hops in my shower, I don't ask questions. I just turn the music up and throw him a towel. You're a lovely person for this. I can assure I am not a lovely person. Probably the furthest from it. I just do what feels human for my buds. You can be an absolute see you next Tuesday all you want. But I bet this means the fucking world to your friend. As someone whose illness put me on the roller coaster of bladder incontinence in my late 20s, I'm still too embarrassed to ask my friends if I can keep emergency supplies at their house. Nope, you're a good person. At least for this. Own it. I'll allow it. This time. Christ. My mom's a senior and suffers from this. She had to leave a day program designed to help people like her for social contact, because the coordinator felt my mom's dignity was affected by the incontinence. Like, holy fuck, lady. Your job is literally to help support her and you failed completely. That makes me feel so sad for your mom. That coordinator is an idiot. Incontinence shouldn't affect your dignity if it is managed appropriately. Abso-fucking-lutely this. I've got a buddy who's special needs and has to wear adult diapers due to incontinence issues caused by a spinal injury from a job he used to work. Anytime he goes to the big amusement park nearby to ride the train there, he has to change diapers once or twice while he's up there, and he got permission from the folks that run the park to use the family bathroom to change. And other park guests always complain. Thankfully, the park staff are fucking awesome and fully understand. So nothing ever comes of those complaints. But I hate seeing my friend get treated that way. Yep, I have something called a rectovaginal fistula. I have a hole between my colon and vagina. I absolutely cannot hold in gas, and I have had to wear diapers to work in the past. I'm 42, and was 37 when this became an issue. Have you seen a surgeon? These injuries are much less common than they used to be, but there are still many surgeons skilled at repairs. As a 28-year-old with severe incontinence due to complete pelvic organ prolapse, I feel this in my heart. It is humiliating urinating myself and having to go change my pants in the middle of interacting with others. A few weeks ago, I went to the emergency room because I couldn't breathe right due to a severely infected throat. I kept begging someone to just look at my throat and they kept sending me back to sit in the waiting room while I was choking and I urinated all over myself. It was devastating and I ended up just leaving. Hyperhidrosis. If someone sees you sweating, they'll think you're gross. My husband had this for a long time, since before we started dating. Then one day a few years after we were married, he went in for a routine physical and blood work. His TSH levels were crazy. Turns out he had Graves' disease. As soon as he started taking methimazole, his hyperhidrosis disappeared. The poor man went through years of embarrassment and self-consciousness before it was resolved. My entire life is planned around how much I will sweat. I deal with this. Last week we had a family gathering, and when it came to taking picture with everyone, it was humiliating. People were disgusted by me and no one could put their arm around me to take pictures as a family, cracking jokes about how I'm sweating all over the family. I ended up leaving without saying goodbye to anyone. I was so embarrassed. I've struggled with this. Nothing is worse than starting to sweat and getting anxious, so you sweat more. My mom once went, "Wow, you're really perspiring." And I was like, "Gee, thanks for bringing attention to this." Now I carry a small fan in my purse that's also a phone charging bank, so if I start to sweat, I can slow it down with the fan. God, yes. It's so embarrassing. My mom would always accuse me of being on meth at family gatherings because, honey, nobody sweats like that for no reason. Your stepdad is outside on the grill and he's not sweating like that. Despite me having this problem my whole life, when I was younger it was just my hands, which is so anxiety-inducing. Now it's my face, chest, back, which is so embarrassing. I used to work in a hotel and I'd be running around like crazy if I had to stop to check a guest, and God, it was so embarrassing. I'd be literally dripping in sweat. I'd have guests and coworkers be like, "Dude, you okay?" I hate it so much. I've started getting the Botox shots to my scalp, and it helps to a degree, for the amount of pain required, and I apologize to the injector nurse for the yelling out when it hit the wrong way, and she said that they schedule for this to happen, and don't have other clinic clients scheduled for the hyperhidrosis clients so they can feel comfortable to scream as loud as needed. And she said there's a young fit lawyer who sweats through 5 pairs of pants a day and he comes for shots to his groin. He apparently yells out "fuck my life" each time. This condition sucks, and anyone who suffers from it has all of my sympathy. That's so shitty. I'm sorry you were treated that way. I developed hyperhidrosis when I started puberty and it was hell. I attended a middle school that opened its doors for the first time on my first day of 6th grade, so the admins were still trying to figure out how they wanted to run the show. Going into 7th grade, they decided that my class was going to be required to wear gray polos. It got so bad that I was regularly taking my own pads and sticking them under my armpits because the sweat stains would be down to my waist without them. Middle school was also where I was bullied the most, and I was desperate enough to try anything that would hide the sweat stains. It was awful. I hate shaking hands with people because of this, and I can't wear heels because my feet sweat so much that they slide down the heels. Does mockery count as demonization? If so, then narcolepsy and its offshoot disorders, IH, etc. It's exaggerated for comedic effect in movies and TV, like Deuce Bigalow, Moulin Rouge. And personally, I don't find it offensive or anything. The issue comes when people just assume that those depictions are representative of reality. No, most people with narcolepsy are not going to fall over asleep while you're speaking to them, nor are they likely to drown in their soup. I don't know if this counts, but I can't tell anyone I have lupus without getting a fucking house joke. And then they want to explain it and I'm like, no.
Yeah.
I got it. OMG.
Yes.
Every time I say I have lupus, it's either the house a joke, or oh my relative has lupus and they died in this terribly painful way, or some jackhole trying to tell you that turmeric, hot yoga, and veganism will cure you. Gee, thanks. Unsolicited home remedies are always the worst. I have chronic migraine and people tell me that weird stuff like drinking water or this or that vitamin will cure my chronic migraine. It's like, gee, why didn't I think of that? It's still chronic even with the Botox, monthly shot, daily pill, and migraine abortives. Sometimes it is lupus. I hate that that show made it a punchline. One of the bad things about House MO, lupus isn't even that rare, as far as rare diseases go. The worst thing was that it overly emphasized diagnosis of extremely specific conditions. And then once the diagnosis was made, treatment was an afterthought. I do pediatric critical care and we do so much medicine without a house-style diagnosis. Still, I don't hate the show overall. As long as we all understand that House is as realistic as Game of Thrones. It's a fun show. But I don't want my surgeon running the CT scanner. Just about any invisible disability you can think of. Yup, I have MS and am in general pretty good health. I keep a cane handy for making sure my potential disability is more visible for those assholes. I don't ever need it. Sometimes I like it to be handy after I walk a mile or two. I have it too, and health has gotten progressively worse since it came off Ocrevus. I always have a headache and fatigue is awful. I just want to nap all day, but I have a job that I have travel for pretty frequently. And young kids at home. It's a lot. I look like a pretty healthy 50 years old, but I have a handicap placard in the car. People who say shit are the worst. Dude, my brain is being eaten by immune system, get off my back about where I park. I keep a crutch in my car for the same reason. I too have MS, and right before an infusion, my partial paralysis comes back on my left side. My physical therapist thought I was trying to get out of using the treadmill until he put the TENS unit on my left knee and maxed out the machine while I told him to turn it up because I could barely feel it. Tried 3 different machines. Got 3 new sets of stick electrodes. Nothing. The vindication was so sweet. I'm sorry your physical therapist sucks so much. Hope you are doing well. Chronic pain intermittently. Of any kind. Yep, no one seems to understand what it is like to be in pain 24/7. My own problem is very severe case of IBS. And what sucks is that IBS is so varied umbrella term, and for some it just is bit bothersome. Maybe bit of bloating here or just tad bit longer times in toilet there. I'm not underestimating their problems. It must be annoying for sure, but they can live normal life, so it isn't taken that seriously, but for some like me it's really serious. Not just talking about the hours spent in toilet, but also that my stomach is in pain. Always, and it doesn't go away. No amount of words can really describe how it feels either. At best, I can almost enjoy things. At worst, I'm actually crying on floor and thinking about suicide because it just hurts so fucking much and people just don't take it that seriously because it's just IBS. Hell, it took very long time for my own family to accept that I actually am as disabled as I say, even though I have actual diagnosis. I do have bunch of other problems too, like bad knees, but the IBS is most life-altering one. I sometimes forget that not everyone knows what it's like, only to be very rudely reminded when I mention something about my baseline level of pain and they're like, my baseline is 0 WTF, like fuck me I guess. Mental illness. Specifically, schizophrenia. Everything I've learned about schizophrenia sounds terrifying for the person with it. Like I cannot imagine feeling so scared and confused and unsure of what's real. It is terrifying. There is also bipolar or psychoaffective disorders. All of the lovely episodes of psychosis. But the episodes come along with crippling depression or mania, which is kind of similar experience to heavy methamphetamine use, not sleeping for days. Or sleeping 2 to 4 hours per night for weeks straight without needing more, massive energy. You start thinking insane things like your partner is trying to kill you and you need to move to Madagascar, everyone is too slow and in your way. You push aside and destroy the relationships with friends and family as they're seen as roadblocks to whatever delusion is going on this time. Except you have no control over when it happens or how long it lasts, and it lasts for at least a week straight, sometimes months at a time when untreated. Insight doesn't come until after, while looking over the smoking wreckage of your life. And psychosis in bipolar depression is undescribably terrifying to experience. Yes, my grandmother is schizophrenic. I feel like there's still a huge stigma now. She was born in the 1950s, and I cannot imagine how it was at the time of her schizophrenia onset in the 1980s. There are so many dumb myths about schizophrenia too. Some people actually still believe it's a split personality disorder, or that second-degree relatives of somebody with schizophrenia are at higher risk than first-degree relatives, i.e., that it skips a generation. My own mother bought into many of these myths. Despite having grown up with a mother with schizophrenia, my great-grandma on my mom's side was institutionalized in the 50s due to schizophrenia. Really messed up my grandma and my mom, so when I started hearing/hallucinating in my teens, I was told, we don't joke about this, so I kept quiet. I'm in my 30s and finally getting the help I need. Diabetes. I was a skinny 13-year-old girl with a life-altering diagnosis, and that just made my peers, including teachers, make digs at me implying I have a bad diet and it was my fault, low-key calling me fat. Same here. People always tell me to eat healthy and it'll go away. What will? My absent working beta cells? This isn't the same. But I'm missing an immunoglobulin and get sick more as a result. And people tell me tips or try to sell supplements to boost my immunity. And I can't get them to understand it's literally something my body doesn't make, not like I need a little vitamin C and I'll be golden. I grew up reading the Babysitter's Club books, and one of the characters was diabetic. I think those books did a good job of explaining it and destigmatizing it. Sounds like more kids need to be reading those books. People are so misinformed about diabetes. It's really annoying. I had half my pancreas removed due to cancer. I told someone I was pre-diabetic due to surgery, called type 3C, and managed like type 1. He asked if exercise would help my diabetes. No, exercise will not cause my body to regrow the removed organ. Rosacea. People never hold back from asking, did you know your face is
so
red? Yep, it's hot and it hurts, so I know. Then the advice. So much advice. I get the same comments with my eczema. Like, yes, I know how my face looks, I too have eyes and own a mirror. And in case I didn't, it also itches/hurts like hell. Crohn's disease. Oof, yeah. I have UC, Crohn's cousin basically, and I don't think people realize that it's more than just gut issues. I have arthritis, chronic fatigue, and an ED from the disease as well. It genuinely feels like having the flu all the time. Migraines. It's not just a headache, and I'm not saying I have one just to get out of stuff. People are shocked when I tell them it's not the pain but the nausea and vision changes that affect me the most. I just had my second round of Botox injections, hoping to feel normal again one day. Mental/psychological disorders. Most people seem to think it's a matter of will and stop being lazy, get out in nature, etc. Hell, for years after diagnosis my brother stopped taking his meds because, I feel fine now. He told us this after he was caught walking naked on Highway 5 in California at 3 a.m. To everyone, it's okay to have an illness, just acknowledge the drugs are why you feel better. And it's okay to keep taking them. I'm sure this is true for a lot of disorders and illnesses, but I have seen it pop up a lot in the bipolar community. I've been tempted just to get hypomanic to get a break from months of depression. I haven't done it, however. Joke's on me. Neither of my meds seem to be working anymore, so that decision has been out of my hands. And if you are high-functioning mentally ill, people don't think you have any mental illness. I've been formally diagnosed with depression, anxiety, PTSD, and borderline personality disorder. I have a full-time job, can hold a romantic relationship, and can manage my finances. I struggle with many of my symptoms, but since I can hold a job and maintain a relationship, people think I'm faking. Chronic depression and GAD here. The noise in my head is outstanding. A lot of allergies are needlessly mocked. I've known people with an intense gluten allergy be given gluten on purpose because a server doesn't think it's real. This sort of out-of-the-way abuse is very strange to me. My husband has celiac, and the amount of people who have asked, well, can't he have just a little, or, have you tried exposure therapy, is insane. I am deathly allergic to peanuts and had a coworker leave shells around on purpose. Luckily, another coworker found them and cleaned them up before I got there. That's just attempted murder. WTF is wrong with people? OMG, yes, I don't think it's real people make me so mad. I have allergies to beef and cow's milk. If it came from a cow, I can't eat it. I am constantly getting people arguing with me that I'm faking it or just being difficult. That butter and yogurt aren't milk products, they are. That mayonnaise is a milk product, it isn't. It's an egg product, that eggs are milk products, or that I can't possibly only be specifically allergic to cows because lactose is in other animal milk. I'm not lactose intolerant, and you can't be allergic to meat because we're made of meat. People get personally insulted when you tell them you can't eat hamburgers and ice cream. Like, I don't know what to tell you. I'm violently ill when I eat those things, and my doctor recommends not being violently ill. I am always astounded by the number of people who think eggs are dairy. Endometriosis. Everyone thinks you're exaggerating or being dramatic, until you try to have a baby and can't. Then you get diagnosed pretty quickly. Endometriosis is no joke. My mom had to have a radical hysterectomy because of it. They had to borrow a surgeon from a neighboring or to help separate the endometrial type tissue from her kidneys and bowel, and they ended up removing a grapefruit-sized tumor made up of the endometrium type tissue. And now we're almost 15 years later and she's starting to experience the same symptoms again. Turns out even a radical hysterectomy, removal of both ovaries, the uterus, fallopian tubes, and cervix, is not a definitive cure for endometriosis. This whole subject triggers my rant button. I'm doing my Master's of Advanced Nursing ATM, and my research project, essentially a mini dissertation, was on experiences of women with endometriosis in the emergency room. As an endo-haver myself, the results made me so fucking angry. Essentially no one is believed, everyone is dismissed. Time to diagnosis in on average 10 years. And one of the major studies out there is on male partners' experiences. Like, we don't even know why it happens, or how to properly and accurately treat it. I don't give a fuck about how the male partners feel about it. I myself was called drug-seeking because I'm a health professional, so I know what to ask for. It's so fucked up. Menopause. My wife is going through perimenopause right now. Apparently a lot of people don't know that that's a thing as well. I exist because my mom thought starting perimenopause meant she couldn't get pregnant. She always had irregular periods due to low body weight. She was a hummingbird, I swear. Never sat still and didn't understand why she was so skinny. So she stopped taking BC. Hilariously, I'm pregnant right now because I thought you couldn't get pregnant during perimenopause. It's twins too. So much fun. Surprise. I had a hysterectomy years before perimenopause, so I didn't know I was even starting it until my anxiety started dominating my life. I couldn't imagine a surprise pregnancy, twins. I'm not sure what emotions you're feeling, but yay! If you're happy, and I'm sorry if you're not happy. Or, I totally get it, if it's both emotions. Either way, I wish the best for you. I'm in peri. Can I get off the ride? I don't like it. Endometriosis, PMDD and PCOS. Chronic pain. Every doctor thinks you're pill seeking. Right now I'm on pain medication. Only as needed, not every day. My doctor's office will randomly call me in for urine tests, and they want me to bring my pill bottles in so they can count how many I have. I mean, I get it. They're worried about getting in trouble. But it still feels really weird and requires a lot of time off work. It's like having a probation officer. Everybody around you thinks you're being dramatic. Oh, yeah. I hurt my back once. Wasn't that bad. The discs in my back are disintegrating due to a possible genetic condition. I've had 6 back surgeries, 1 spinal fusion, bone spurs, etc. It's just a headache. I used to suffer from 28 migraine days a month. Felt like I was being stabbed in my left eye constantly. A Jovi fixed that. Thank goodness. Only took 20 years. I still work full-time and keep my house in order, but at a huge cost. Edit, and I realized I'm defending myself. You always have to do that with chronic pain. You have to reassure people that you're not taking too much pain medication, and you have to promise everyone that you're still a contributing member of society in spite of it all. I don't have a choice since I need money to live. Luckily, I work from home most of the week and have a setup to where I can work from bed if needed. It's the only way I'm able to avoid taking more pain medication. A lot of people with chronic pain don't have that luxury. I hate it, hate it, hate it, hate it. It wears you down. My mom has the best answer to bullshit from people. But you look fine. Because I work really fucking hard at looking fine. I slowly realized I was getting annoyed at the fact that my family wasn't helping more at home. Then I realized it was because of me. I felt the need to prove myself from my first surgery at age 12 all the way into my late 40s and early 50s. I was constantly hiding how bad it is just so I didn't look disabled. Now I'm honest about it. My ex was pretty useless when I initially tried to let on how bad it was. And between that and doctors who told me it was just transferred pain from my spine issues, I just figured I was stuck still doing everything. My now husband is a freaking saint and actually heard me. Of course. Years of being told it was nothing and pushing took its toll. Doctors still minimize it. 2 spinal fusions, a torn hip they can't fix, pinched nerves, neuropathy, and severe arthritis, but yeah, I just need to get over it. Herpes, there are 2 major types. And many people only seem to know that one. This is the one I came here to say too. 10 years of working in GYN and watching people have complete breakdowns because they think their lives are over. All for an STI most of us probably have had contact with and just developed antibodies for instead of becoming symptomatic. I read that as you worked in gym, and I was wondering how people are catching herpes at the gym. Same. Didn't notice till I read your comment. And most people who have it never show a symptom. And have no idea they're carriers. BC STD labels don't include HSV. Most people don't know this. Postpartum depression and psychosis. With intervention these are both treatable. You'd be surprised how many people automatically assume that you're weak or frail when you tell them you have an autoimmune disease. But some of them are the opposite and happen because your white blood cells are out of control and too strong and attack your body. In my case, I have 2 that go hand in hand, ulcerative colitis and rheumatoid arthritis. One attacks the lining of colon, the other my joints. Menstrual pain. My daughter has a severe peanut allergy. The amount of people that roll their eyes at allergies is amazing to me. Allergies are no joke. ADHD. People still think it's just being lazy with extra steps. I've been medication controlled for over 20 years now. Every time I move there is a whole song and dance when I set up new care. I had one doctor flat out tell me they don't believe in it and would not prescribe my medication. When I was trying to get pregnant, I was told to stop my medication. So I did for 5 months. My husband had no idea what I was like without my medication. He did not recognize the person I became. I went through a bout of depression. I basically just stayed in bed. I had zero interest in doing anything. He was shocked. For me, without my medication, I have no positive feedback loop. I literally have no sense of accomplishment. My world is the same if I do the dishes or not, if I go out and see friends or not, if I finish that project for work or not. With my medication, checking things off my to-do list makes me feel good. I feel things like pride, satisfaction, and fulfillment when I complete a task, no matter how big or small. ADHD sucks. I have ADHD and I really appreciate your reply. My mom freaked out when I started Ritalin after diagnosis as an adult, because she's a hippie and she was scared of it, and I had to very gently explain to her that I was struggling every day to the point of acute depression and anxiety, with a side of suicidal ideation, and that Ritalin, and antidepressants which she also didn't like the idea of, helped me to literally not want to kill myself every second of every day. Like, it's not just, oh that person is hyper. It's literally can be crushingly debilitating to the point of suicide. Really, though, it's awful because it's illogical. Yes, I see that giant pile of mail I still need to sort through, or that the trash is overflowing. Yes, I know it needs to be done and there's probably something important in there. Yes, it really shouldn't take so much time and energy to just get it done. And yes, I'm sure it'll be easier to just do it, rather than let it continue to sit. But my brain and my body will not let me. I don't have control over this. No amount of discipline, routine, habit, and just simply knowing better is going to change that. And nobody outside of me cares that it takes 10 times as much energy and willpower to do simple, everyday, menial things because I have ADHD. I can do something literally daily for years, and if I let myself skip for even a single day, that lifelong habit is destroyed and I have to do so much to get back into the swing of it, and yes, 90% of those instances revolve around hygiene and self-care. I'm well aware that it doesn't make sense. It's fucking debilitating and exhausting and nobody fucking gets it. And when we seek medication we're treated like junkies. Thanks for the award. The amount of times I'm basically internally screaming at myself to get up and do something, it's infuriating. Like being a passenger to myself. Yes. I'm a HS teacher and I've tried to explain many times to my non-neurodivergent teacher friends how hard it is to get over the executive dysfunction. My friend the other day was like, you just gotta do it. Just make yourself do it. And I was like, that does not work for me, nor does it work for our students. Most kids don't want to be failing their classes, forgetting papers in every class or deadlines. I've walked out of my classroom to my car without my grading, my cell phone, my laptop. It's just like a million extra steps to reach the same functionality level of normal people. It also makes me really tired, so I don't want to hang out with people as much, and then I'm the one who's always tired. Like I don't have the energy to drive 45 minutes each way to do something. All my executive function went to just surviving adulthood today. Acne. As a lifelong sufferer of hormonal cystic acne, everyone just assumes I don't wash my face. The number of people who have attempted to or felt entitled to lecture me on how to wash my face or how their cousin put raw eggs on their face every night and their acne magically disappeared is absolutely wild. Everyone from distant family to complete strangers. I guarantee you someone may not read this entire post and comment about how XYZ medicine and silk pillowcases cured their acne. It was much worse when I was younger. Accutane came out when I was 25, and while I was not a good candidate for it, other treatments like certain antibiotics and hormonal medication keeps the acne minimal. I'm 40 now and still have flare UPS, but this simple thing has completely changed the trajectory of my life. My self-esteem, my self-image, how I present myself, always makeup, my bedtime routines, etc. Stuttering. People seem to think that you're an idiot. Your views and opinions are not taken seriously, no matter how well thought out they are in your head. HIV/AIDS is still so stigmatized. Lost a parent to this and have ended friendships over gay comments before. It fucking sucks. Good, but shit. Way to sort out who isn't worth having in your life for sure. Hearing loss. Big fucking joke. First comment is generally, what? I got panic attacks in the night worrying that I would lose my whole ability to hear. Not fucking funny at all. Endometriosis. Being fat. Missing teeth. Mental illness. Missing teeth for sure. I have a condition that caused my teeth to develop with a serious lack of enamel. And at 26, I've had 4 teeth pulled with another one planned soon. And I've had so many root canals that I've legit lost count. Restless leg syndrome. Sounds ridiculous until you have it. I lurked in some gestational diabetes subreddits while being tested multiple times for it and the amount of, but I'm skinny. How did I get this? I see in those spaces was shocking. It has nothing to do with weight or diet, it's from genetic material in the placenta. Honestly, any condition that is either related to weight or perceived to be related to weight is stigmatized beyond belief. Try being a type 1 diabetic and having people tell you to just change your diet. Will that make my pancreas work again? Ostomies and incontinence. People would literally rather we continue to have cancer, you see, and terrible quality of life than shit in a bag attached to our abdomen or need a brief at night. Probably anything a woman has. I complained to my GP about being exhausted. He said I probably was just stressed from work. Later went to the gynecologist because I wasn't getting a period but also had negative pregnancy tests. She believed me and ran some tests only to find I had a 3.9 hemoglobin and undetectable iron levels. I have an autoimmune disorder that my mom had and they knew because it was in my history. Yet my GP accused me of being stressed. Lung cancer. If you get another type of cancer, you're a brave soul battling an unfair illness. If you get lung cancer, that's your comeuppance for smoking, even if you never smoked or quit decades ago. People really feel it's a deserved. That shit sucks, especially when lung cancer runs in my family. Reminds me of liver disease too, with the comeuppance for drinking, even if not everyone who has it drank. Had to really look for this one, but it's the first that came to mind. Any lung disease is similar. Way less money for research. Way less money donated. It's exceptionally stigmatized, which leads to people not getting diagnosed until stage 3 or 4. Really sad. My husband died from lung cancer at 42. Yes, he smokes. But his father smoked in the house like a fucking chimney. My mother-in-law also died from emphysema/lung disease and never smoked. Again, my father-in-law would smoke a 40-pack of cigarettes a day whilst sitting next to her. He never quit when she got sick. I still don't know how he got to live into his 80s, and the two that actually cared for other people didn't. Addiction. People often think it's a moral failing, and most of the time they deny it's even a medical condition. Edit. The responses I've already received are already proving my point. Why don't you just drink less? Because if I can't get obliterated, I don't even want one. 894 days alcohol-free. Amazing how fast the responses proved your point. I'm an addict in recovery for almost 7 years, and even I have moments when I just want to shake a friend of mine and tell her to literally just fucking get your shit together. Oh my fucking god, seriously Jen, goddamn it. And I know she can't. And I know it doesn't just work like that, and I know she is full of shame. And I know all about living as an addict and trying, and not trying, to find recovery. There are times when even I have absorbed the culture around me that feels like, well, if I can do it, they should be able to do it too. And the truth is, I don't know how bad their disease is. I can tell myself these things and still, the culture around me twists things for me sometimes. Came to say this and not at all surprised that the comments are proving this to be right. It's ridiculous that addiction gets demonized, because it's something that your body just naturally does. The true moral failings are that we've created conditions in which people either turn to substances for escape, i.e., poverty and trauma, and that there is so little support due to stigma for having an addiction. We are all just one painful medical condition away from being prescribed pain management medication and accidentally slipping into addiction, because our bodies just do that. And those who took more active participation in their initial uses via narcotics and alcohol are not any different. They are also people seeking relief from some kind of pain. The way to combat this is not through shame, but through structural changes that lessen or eliminate the reasons people become addicts in the first place. I so understand this. I have a loved one with pornography addiction, and it's often dismissed with, oh, that's just a guy thing. Yeah. But normal consumption doesn't involve spending hours and even missing work and covering up expenses for the habit. Addiction is a bona fide disease, and the brain is actually altered to chase whatever substance to produce the high and disconnect from reality. Even without the consumption, the desire remains constant. It's a lifelong battle for those who are afflicted with it. Most addicts are self-medicating very real conditions too. I've seen it in my own family: trauma, CPTSD, undiagnosed mental illness, disabilities, etc. It's a logical, if extremely destructive, choice given the circumstances. Lack of support for addicts is really a socio-cultural failing. I had to make the soul-crushing decision of leaving my husband due to his alcoholism. It's one of the few diseases that takes down everyone around the infected as well. It's an angry, vicious, spiteful disease. Nothing hurts more than loving someone more than yourself, but having to put yourself first. I think something difficult about addiction especially is how much it affects others. Both my parents are addicts. My mom has been clean over 5 years, my dad is still an alcoholic. It's hard not to be frustrated and angry by the fact my dad can't help me put up a shelf or spend time with the family without getting drunk. It's hard not to get upset that my dad gets drunk and starts fights with everyone about everything. Addiction gets demonized because OT hurts everyone around you too, and it's hard to have sympathy towards the addict when they just keep hurting you. God, the responses are so disappointing. Pancreatitis. It's painful and requires high doses of pain medications to treat. Sometimes, a PCA, push-button pain pump, is needed. Some doctors skimp on the pain medications in the name of reducing opioid use when it's needed. Fuck me, I remember my first attack and I couldn't leave the bed for 5 days. It felt like a knife that couldn't be removed and just kept twisting. Chronic fatigue syndrome, bipolar disorder. People act like they expect them to set fires and kill kittens. And I acknowledge that it does occasionally happen, but there's a huge number of people with it, and no one knows that they're just through to go through the day. They're mentally exhausted just trying to make it from morning to night, right? Kill kittens? Nah. Man, I wanted to kill myself. Frequently. And even the mania wasn't the fun kind. I was just paranoid and agitated and full of rage. My best friend has bipolar and yeah. When he's hypermanic and without his meds he is intense, but honestly he's the one in the most danger. Before he got medicated I remember him almost getting hit by cars several times. Even with meds his hypermania will give him insane insomnia and he finds it so frustrating. He'll often tell me how he wishes his brain would slow down because it'll feel like there's never enough going on for it to feel satisfied. It's sad to see the condition looked down on like it is.